Hello, my name is Bob Sherrar. I am a physician and epidemiologist who has spent a lifetime working on public health issues. I am the current chair of the section on public health and preventive medicine for the College of Physicians of Philadelphia. I would like to welcome you to this webinar series on climate change and health in Philadelphia. I would also like to thank Dr. Marilyn Howarth and the members of the academic public health programs who put this wonderful series of presentations together. Climate change is one of the most important public health issues facing our worldwide community. This webinar series was put together because the public health community must know and understand the huge impact that climate change will have on human societies throughout the world. And we must work together to lessen its impact. Now, Philadelphia is blessed with a wealth of public health talent. There are 8 schools in the Philadelphia metropolitan area that offer training in public health and hundreds of students working on various public health degrees. The purpose of the section on public health and preventive medicine is to bring this vast public health community together to address issues facing our communities. Any person interested in public health may join the section, where they can network with the public health leaders of our community. You do not have to be a member of the College of Physicians. Student memberships are free. To learn more about the section, go to the college's website and read about the various activities that we sponsor. Now, sit back and relax and learn from these wonderful webinars. Thank you.
Hello, I'm Dr. Marilyn Howarth, Chair of the Environmental Health Committee of the Section on Public Health and Preventive Medicine at the College of Physicians of Philadelphia. As faculty at the University of Pennsylvania School of Medicine, I direct the Community Engagement Core of the Center of Excellence in Environmental Toxicology. My work focuses on environmental impacts to health. I work with communities, healthcare professionals, regulators, and legislators to improve environmental health. Through that work, I've seen extreme weather and flooding in Philadelphia and the region and health implications for residents. In organizing this webinar, we aim to enhance learners' understanding of the health impacts of extreme weather and flooding in Philadelphia and elsewhere, and recognize the role of government and public health professionals in preparing, mitigating the impact, and recovering from recurrent extreme weather events and flooding. Here are the competencies that this webinar supports. Those of the Council on Education for Public Health and the Association of Schools and Programs of Public Health. Our speakers today represent community, government, and academia. We will begin with Brenda Whitfield, a longtime resident of the Eastwick neighborhood in Philadelphia and a community leader in Eastwick United. You'll hear about the long struggle of residents to engage their government to constructively help them with recurrent flooding and what it feels like to have property and utilities damaged repeatedly. You'll also hear hope and resilience born of her lived experience and recent successful collaboration with government. You'll hear from Dr. Anneclaire Roos, Professor of Environmental and Occupational Health at the Dornsife School of Public Health of Drexel University. Dr. Roos will describe the complexities of the different types of flooding, the intermediate and later health effects and impacts on drinking water. She will discuss our current limitations on data collection and what strategies individuals and public health professionals can use to mitigate health impacts. Joseph Sullivan, the Program Manager for Flood Resilience and Compliance Strategy for the Philadelphia Office of Sustainability, will discuss why Philadelphia floods and how climate change is impacting flooding in Philadelphia. He will describe how municipal government gauges the vulnerability of the city and its residents. He will discuss the many components necessary to coordinate municipal management of floodplains. Here is our first speaker, Brenda Whitfield.
So hello guys, my name is Brenda Whitfield. I am a resident of Eastwick community. My husband and I moved into the neighborhood in 1970s. And wow, we were so excited, getting your first home, moving into it. Moving here was the best thing that could have ever happened to us. We were in the neighborhood for over 20 years before we really had our biggest flood. That flood took place in 1999, which was flood, and it hit us for a loop. But mind you, we had been having little floods all along, but we were able to recuperate, get our things together, and just keep it moving. But boy, we had no idea what we were in for. When 1999 came and flood hit, it was devastating. The waters came up to like 4 to 6 feet. In the basement, we had no idea. There's no warning. It just comes. After we had flooding in 1999 with flood, and we realized that we didn't have any help coming, we hurry up and learned how to band together. We didn't have the luxury of having Red Cross because they didn't really know about Eastwick. So we didn't have the luxury of having the city coming out to help us clean up. So we had to do it on our own. Since then, we have had several other floodings. Isaias, we had Ida, we had some small tropical storms that we had to deal with. Every time it floods, we have to replace the air conditioner. We have to replace our water heater. We have to replace the air vent. Cost starts at $6,000. In flooding that comes in that flood water, we get mud, big mud that comes into our basement. Whew, it's a lot of work. But what my family and I did, and my children, my grandchildren, we come together to clean up. And yes, you have to use tons of disinfectant because of the fact it is flood waters. And along with it comes all of this mud and dirt, and it's just unhealthy. That flood waters come in and it is 6 to 8 feet high, which means it is in the walls of the house and the drywall. So whenever you're replacing the appliances, you also have to replace the drywall. And you have to also make sure you replace the wood and all, because if you don't, mold comes. And everybody knows that mold is unhealthy. So you have to make sure that you're washing down, disinfecting, using brushes, using mop, and having gloves on. We're on our knees and hands. We are scrubbing. No one told us that this was a floodplain area. We had to find out the hard way by living and going through the floods that transpired through the years. When we came together, we realized that we did not have flood insurance as well because it wasn't required. Flood insurance 20 some years after we moved here was mandatory. And the flood insurance was as high as $6,000 a year. So then we had to band together to get them to recognize that we cannot afford that high flood risk, and it's mandatory insurance. So we worked together to let the people know that we needed flood insurance out here, but also that it had to be affordable insurance for the community. When we started talking about how we could get out of harm's way and the slow action that the city took in making sure that we were out of harm's way with flooding. But the biggest challenge was talking with the Army Corps of Engineers. The Army Corps of Engineers didn't understand what it was like to be in a flood zone and the harm that it was putting us in. And coming to the table with the Army Corps of Engineers has been a real challenge. And the challenge is because we have been talking about flooding for over 20 years. And in that process, every time we would come to the table with someone that was supposed to be dealing with flooding, like the city, like the Army Corps of Engineers, it would be, I'm sorry, we're under a new manager. And we have to start from the beginning because I'm new and I don't know about the flooding in your area. That's not acceptable. That's not acceptable. For over 15 years or more, this has been the answer to our flooding situation out here. That's a bit of taste in my mouth. Because for years we had to deal with these answers as the solution for our problem out here in Eastwick with flooding, which was so unfair to the residents out here. We're hard workers and we come from all different walks of life. We are international out here, and to be treated like we didn't matter just made it even worse for us and the way we were feeling. I lost the hope. I lost the compassion from the city. The ones that are supposed to be looking out for our welfare seem to have turned their backs on us. I think that if we had not come together as a community, I don't know where we would be. Because the community, back in the day, we actually was marching on Lindbergh Boulevard to say, don't forget about Eastwick. We flood out here. We need help. It was the marching and the constantly begging of different politicians to hear us and to finally come to our rescue. One thing that the neighborhood had to learn in one of the bad floodings that we had is that we needed a warning system. We didn't have a warning system out here in Eastwick. To be honest, the warning system was my family. We would go to the creek, see how high the flood waters was, and then the grandkids would have to help knock on the doors, pass the word how high the creek was, and if it was overflowing, and that was devastating within itself. For an example, at one flooding, which was 6 feet, my grandson had to actually go to our recreation center to help save the young ones that was in the flood at Eastwick Recreation Center. In our meetings, this came about to let them know that when they warn in the city that it's flooding, it has nothing to do with us out here. That when the city is being flooded, we might be A-okay. We needed a warning system to say that the Darby Creek, Cobbs Creek, all of those waters and storm things are coming together and that we need to evacuate. So now we have a storm system, we have a sewer system that is working with the flood system out here in Eastwick. I'm just elated that we're able to come together, to have a solution, to have the different groups to come together for the good of the community and the organization. I'm thanking all of those that came to the table. I'm thanking all of those that have stopped and said, we're listening to Eastwick members and residents here. We care about you. No one should have to live in anxiety every day, every time it rains. Every time it rains, for some people, it's serenity. For Eastwick, it brings about anxiety. It brings about uncertainty. I'm not as anxious as I was when I first moved in and had the first flooding, and because now we have a seat at the table. We are being recognized. It seems as if they have heard our cries and they are listening to us. And they want to put us in a place of being complete, because we weren't complete. I just feel like there's hope, and there's going to be a legacy for Eastwood to have out here, that there will be something for the next generation to be happy about, that they won't have to be content with flooding. Flooding hasn't gone away, and we're still going to have flooding out here, but the fact that there's solutions out here to protect the homeowners is such a relief. And I'm really excited about the future for our next generation. So the legacy that I will be leaving behind is a legacy that I can be proud of, that they can look forward to passing on to the next generation, and that they will want to be in a community that is healthy, that has an environmental, not injustice, but environmental justice ahead of them.
Hello, my name is Anneclaire Roos, and I will be speaking to you in this webinar today about flooding impacts on public health and safety. A bit about me for context. I'm trained as an epidemiologist. I'm on faculty at Drexel University as a professor of environmental and occupational health in the Dornsife School of Public Health. I conduct research on various aspects of the environment's impact on health, and I have ongoing research projects on health impacts of extreme weather in children, extreme weather events such as heat waves, intense rainfall, and flooding. In this presentation, I will cover a flooding overview, health and safety impacts, and risk planning and prevention. First, some definitions. A flood, as defined by the National Weather Service, is a general and temporary condition of partial or complete inundation of normally dry land. It's important to understand that flooding can take many forms. A flood can be distinguished as a flash flood, which is defined here as a flood caused by heavy or excessive rainfall in a short period of time, generally less than 6 hours. In contrast, some floods develop slowly and can be quite prolonged, with floodwaters lasting for weeks or months. While flash floods are more immediately dangerous to life and health, slowly developing floods, which are not flash floods, are also associated with substantial health impacts. Before we talk about health impacts, I'd like to review some of the main causes of flooding. First, riverine, or otherwise known as fluvial flooding, is what many people think about when they consider flooding. It's caused when rainfall or snowmelt exceeds typical river channel drainage capacity. Riverine floods are somewhat less likely to be flash floods than other types, but this is not always the case. A recent example is the flash flood that occurred in the Guadalupe River in Texas over the 4th of July weekend this year. This is the flooding that resulted in over 100 deaths, including some campers and counselors from Camp Mystic. The area was known for flash flooding, and that is, the river is surrounded by hills that funnel into narrow limestone riverbanks with limited drainage capacity. In this case, the flash flood occurred at night when most people were asleep, making it even more catastrophic. Pluvial flooding is much more common than riverine flooding, but in many instances, the flooded area is smaller in size. Pluvial flooding is also called sometimes urban flooding or inland flooding. It happens when rainfall or snowmelt exceeds the infrastructural drainage capacity of an urban area. It can be due to the fact that urban areas have extensive impervious surfaces like buildings and concrete and not enough green space for infiltration of water. Also, blocked sewers cause this type of flooding, and the fact that many urban areas have limited sewer capacity for the amount of stormwater during a heavy precipitation event. This can be particularly troublesome for health because many cities have old, outdated sewer systems which are combined with the stormwater drainage infrastructure. When the capacity is overwhelmed, this leads to combined sewer overflows in which raw sewage is diverted into local waterways. Third, I'm going to touch on coastal flooding. This cause of flooding can impact very large populations because of development and a lot of population density along coastlines. Coastal flooding is caused when strong winds blow along an ocean or lake surface and cause water to pile up as it approaches the shoreline. This process can be exacerbated by normal high tide and also sea level rise due to climate change. Floods in general are becoming more frequent and severe for several reasons, including climate change and urbanization. With regards to climate change, heavy precipitation events are increasing over time. This graph from a governmental report shows that storms expected to occur on average only once every 5 years have been happening more frequently since the mid-20th century. Rainfall is not only happening more frequently, but also with greater intensity, which means that more rainfall is falling in a shorter period of time. And this is happening for several reasons, including the fact that global temperatures are increasing and warmer air can hold more moisture. With regards to urbanization's role in causing flooding to become more frequent and severe, urbanization is changing landscapes and increasing the size of populations at risks. Urbanization is increasing rapidly in recent decades. By 2050, it's projected that 70% of the world's population will live in urban areas. This urbanization process mostly happens by expanding urban areas, and those urban areas frequently expand into floodplains. One study found that global urban expansion into 100-year floodplains increased by more than fourfold from 1985 to 2018. Also, with urbanization comes development, leading to more impervious land cover and less green space that can facilitate drainage, not to mention covering or diversion of natural waterways. Finally, greater population density with urbanization leads to more water use and sewage, with the possibility of overwhelming the sewer capacity. So you can see that with climate change and increased urbanization, flooding is becoming more frequent and severe. This figure illustrates slightly increasing number of flooding events over time since the 1970s. That is the blue line on the graph. And it also shows greater numbers of people being affected by floods over the years, with roughly 50 million to 300 million people affected each year. It's important to note that these types of statistics usually only include large floods, the type of floods that make the news. They do not generally include pluvial flooding or intra-urban flooding, which might affect only half a block or even only one person's basement. So inclusive statistics would be higher than those documented here. On the topic of pluvial flooding may be more common than previously thought. In a survey that was conducted in Detroit, Michigan, that included over 3,800 homes, researchers found that over half of the homes reported experiencing pluvial flooding. Pluvial flooding was most frequently reported by survey responders who lived in rental occupied units and also those with poor housing conditions, such as poor roof quality and cracks in the basement. In general, the researchers found that household factors were more predictive of pluvial flooding than neighborhood factors. The health impacts found in epidemiological studies of floods are quite diverse. There are a lot of different types of health impacts that have been studied and linked to flooding. They also tend to occur in different time frames relative to the flood event timing. And they can be categorized into immediate impacts such as drowning and trauma, early impacts that usually occur within 10 days or a couple of weeks after the event, which typically include various types of infection, and late impacts more than 10 days or a couple weeks after the event. These include longer term impacts such as mental health impacts. The primary cause of flood-related mortality is drowning. Drowning accounts for about 75% of all flood-related deaths. Other common causes of death during flooding are falls, car accidents, hypothermia, electrocution, heart attack, and carbon monoxide poisoning. The risk of dying during flooding is largely determined by the extent of flooding and the speed of the floodwaters. However, some studies have found that males are at greater risk, perhaps due to risk-taking behavior, and also using a motor vehicle during floods is related to increased risk of death. About half of all flood-related deaths are motor vehicle related, and that includes the drivers and passengers being at risk. Overall, in the US, there are about 100 deaths per year caused by floods, and this average fatality rate has not changed significantly in the US over time, despite more frequent and intense flooding. However, flood-related fatalities do vary substantially among different parts of the world. Deaths are concentrated in Southeast Asia, which accounted for 69% of flood-related deaths globally in this one paper that is shown in the middle pie chart. And the 69% of all deaths is disproportionate to the size of the affected population in Southeast Asia, which was 35% out of all people affected globally. The Americas, including North and South America, and the Western Pacific region also had disproportionately high number of deaths from flooding. In general, this study found that the majority of flood-related deaths were concentrated in less developed and heavily populated countries. They reported that flood mortality rates are relatively similar across continents, but floods in Asia result in more deaths because they affect substantially larger areas with larger populations. Non-fatal injuries are common in floods, but these injuries are not always counted since they aren't always seen in the clinical setting. Wounds and trauma can happen from contact with debris and floodwater, leading to lacerations, punctures, and contusions. Also, walking through floodwaters can lead to missteps, which can cause sprains, strains, and falls. Also, again, car accidents are a common cause of injury, non-fatal injury due to flooding, due to difficult driving conditions leading to accidents. And finally, floodwaters do not only contain debris, they also often contain chemical spills and leaks, which can lead to skin irritation and poisonings, another type of injury. Waterborne infections are a health impact that occurs quickly, but not immediately after a flooding event. Usually infections show up within 10 days of flooding exposure. A waterborne infection is defined as an infection in which water was the proximate vehicle for exposure to the causal agent. In other words, water carried the pathogen to the person who was affected. Waterborne infections are caused by pathogens from various taxa, including viruses such as norovirus, bacteria such as E. coli, Salmonella, Streptococcus, and Vibrio. And in less developed countries, this can include cholera and leptospirosis. Also protozoa, including Cryptosporidium, which is quite common in the US, as well as fungi. People are exposed to waterborne pathogens through floodwater, stormwater, drinking water, and recreationally. Of course, here we're focusing on floods. And the route of exposure to pathogens and which may cause waterborne infections, can be through ingestion, also through inhalation or dermal contact. And these pathogens can cause gastrointestinal infections, skin and soft tissue infections, respiratory, and other types of infections as well. How does this happen? With heavy precipitation, runoff picks up pathogens from contaminated areas of land, such as agricultural areas, animal feedlots, and also urban areas that have animal waste. In addition, as we know, heavy stormwater drainage can lead to combined sewer overflows into local waterways containing various disease-causing organisms. Stormwater runoff contains this contamination, and then it can become pooled and concentrated in flooded areas. People are exposed to waterborne pathogens during flooding in various ways, most clearly by direct contact with floodwater, such as by walking through floodwater or putting your hands in floodwater. But exposure can also happen by breathing in contaminated water droplets or when water gets in people's ears, eyes, or nose. This can happen during various activities like cleanup after floods, and even when simply walking or biking through stormwater puddles. Drinking water is also a common pathway for pathogen exposure after flooding, as there can be contamination of wells or failures of water treatment systems during flood disasters. Overall, across many epidemiological studies, there is a small but quantifiable impact of flooding on infections in the subsequent days and weeks after a flood. It's important to note that flooding is difficult to study because only large floods are regularly documented. Pluvial flooding often is not documented in where it happens and the extent of pluvial flooding. For this reason, most studies examine proxies for flooding, like heavy precipitation, rainfall intensity, or stream flow. Also, it's impossible to know whether one person's infection was waterborne or whether it was caused by a particular flood without genetic analysis of the pathogen and linking cases together. So most studies do not identify particular pathogens associated with a flood. They instead examine indicators of infection rates like ER visits for acute gastroenteritis or cellulitis, and they look at infection rates in exposed people and compare infection rates in the same people before and after a precipitation or flood event. I'd like to highlight this next study because they took a comprehensive approach to investigate extreme precipitation as a cause of waterborne disease outbreaks across the entire continental US over several decades. In this study, Carreiro et al. In 2001 compiled a list of over 500 waterborne disease outbreaks that were recorded with the Centers for Disease Control that occurred in the US from 1948 through 1994. And they extracted precipitation data within the watershed where each outbreak occurred for the months preceding the outbreak. This map shows where all the outbreaks occurred, and you can see that they're documented in various regions of the country. What they found is that heavy precipitation frequently preceded waterborne disease outbreaks, more than by chance alone. 51% of the waterborne outbreaks were preceded by precipitation events greater than the 90th percentile, meaning those precipitation events, the amount of precipitation was greater than 90% of the other storms happening during that time period. And they found in particular that surface water-related outbreaks were associated with precipitation that occurred within 1 month before the outbreak. The next study I'd like to talk about is interesting because instead of looking at flooding directly or heavy precipitation as a proxy for flooding, they looked directly at combined sewer overflow events, since this is a primary source of microbiological contamination in urban areas during storms. They found that children with combined sewer overflows that occurred within 500 meters of their home had 16% higher odds of emergency room diagnosed acute gastroenteritis that on the second day after the CSO event. So you can see that the estimated risks are small in these type of studies. Here it was a 16% increase in odds. And associations in this type of research can certainly happen by chance, but it's only by seeing these types of associations in many studies of flooding and heavy precipitation and infections over many studies that we have confidence in the association. And the final study of flood-related infections I will cover is of interest because they actually looked at exposure to floodwater from pluvial flooding in the Netherlands and the types of activities associated with infection risk. In a small survey of persons in neighborhoods known to have been affected by pluvial flooding, people were asked about their activities during the flood and also illnesses after flooding. In a multivariable analysis, the researchers found that people who reported their hands were wet or dirty with floodwater had higher risk of gastrointestinal illness and also skin complaints, but influenza-like illness was not associated. Influenza-like illness was associated with cleaning up floodwater and cycling or walking through floodwater. This is an interesting result since these are activities that may result in aerosolization of floodwater and breathing in pathogens. Finally, delayed or prolonged health impacts can occur more than 10 days or even a couple weeks or even months after the flooding event. And they can not only be delayed, but sometimes they could be quite prolonged as well. This includes various types of health impacts, such as wound infections by more rare, different types of pathogens, hepatitis, mosquito-borne illness that occurs after mosquitoes breed in the floodwater, allergy asthma due to the increased allergens such as mold that grows in flooded areas, and also mental health disorders. I'm going to focus here on mental health disorders. There's growing recognition of a link between climate change and mental health impacts. A term, eco-anxiety, has been coined by the American Psychological Association that recognizes eco-anxiety as a chronic fear of environmental doom. So, young people especially may be primed to experience mental health impacts from climate change-related events. Common mental health disorders like anxiety and depression have been reported as impacts following large-scale natural disasters such as flooding, thunderstorms, also wildfires and other extreme events. And these studies have found a greater risk for those with weather damage to homes or residential displacement. One study found adverse mental health outcomes were most prevalent after experiencing multiple extreme weather events compared to only one. This is an interesting study from some of my colleagues at Drexel that I'd like to highlight. In this study by Anneclaire et al. 2024, they looked at the U.S. Youth Risk Behavior Survey from 2019, which included over 38,000 high school students residing in 22 urban public school districts in 14 states. They obtained information on climate-related catastrophes from FEMA, and most of the disasters that were recorded were classified as storms, hurricanes, and floods. Information on mental distress in the youth was from survey items of feeling prolonged sadness or hopelessness, and also short sleep duration. What the authors found is that they found a higher prevalence of mental distress among adolescents associated with a greater number of days of climate-related disasters over the past 5 years. In contrast, they did not find any association with disasters counted over the past 10 years. So this does suggest a cumulative impact in that the number of climate-related catastrophes was important, but with a limit to the relevance of events in the past 5 years and not in the distant past. Finally, I'd like to talk briefly about risk planning for floods and prevention, with a focus on how people can protect themselves against health impacts in a flood. It's important to know that exposure to a flood is not the only determinant of whether health impacts will be seen. Certain populations and certain groups of people are more sensitive to health impacts from flooding, such as elderly who are more susceptible to infections or even injury. And children may be more sensitive as well because their exposures are different in that they have a lot of hand-to-mouth behavior. So that's important to note. Also, adaptive capacity is important to consider, and this is where planning and preparation comes in. With planning and preparation, a population or even a single family can increase their adaptive capacity such that they can prevent health impacts from happening when they find themselves in a flood situation. Risk planning is very important to do at an individual level, within individual families, and also within neighborhoods. It's important to build a culture of safety from the bottom up that can supplement safety measures that are occurring at the city level or with statewide or even national policies. In this type of risk planning, it's important to investigate your flood risk and understand your flood risk. You might not know whether you live in a floodplain. And also, since pluvial floods are not mapped in floodplains, they often don't occur in floodplains, it's important to be aware of where flooding typically happens in your neighborhood. Make a flood response plan, know your safest path to higher ground, have phone numbers available for emergency services and medical services. In this type of planning, it's very beneficial to involve neighbors such that neighbors can work together in this type of catastrophe, and also identify vulnerable people in the neighborhood who may need additional help, such as elderly people living alone. Prepare an emergency kit with medications, first aid, and masks, gloves, other types of protective equipment. An emergency water supply is extremely important, especially for flood disasters. And so that should be maintained on hand and in a higher level of your home if possible. Also, a generator may be important if you're reliant on electrical equipment for your medical care, such as a nebulizer. You might want to have a generator on hand for this type of emergency. Consider getting flood insurance. It's not always available, and certainly not everybody can afford it in some cases. But it's good to have on hand, especially for very unexpected flood events, such as in urban environments away from riverbeds. And lastly, heed flood warnings. Jump into action when flood warnings are given, and do not disregard flood warnings that tell you to evacuate. There are various things that people can do to prevent health impacts from flooding during and after a flood. First, do not attempt to drive or walk through floodwater. It's very difficult sometimes to see how deep floodwaters are or how fast the current is moving. Second, avoid any direct contact with floodwater. Avoid getting floodwater on your skin. As we've learned, floodwater is full of pathogens and often chemical contaminants as well. Use water from a safe source for drinking and cooking. Also, use protective masks, goggles, and clothing when cleaning up after flooding, and also cover any wounds with a waterproof bandage. After cleanup or after any contact with floodwater, wash your hands frequently, and also shower and wash your clothing after cleaning. Finally, clean and disinfect parts of your house that were contaminated, that in contact with flood water. Clean and disinfect any equipment and also household items such as children's toys after floods. Furthermore, be sure to protect yourself in the weeks after a flood. Be aware of any changes in your health or mental state and seek medical care if needed. Long-term health effects, as mentioned, some can be prolonged. These can be later appearing infections, especially skin infections, and also changes in mental state. And revise your emergency plan if needed. This is a good opportunity to reflect on what worked and what didn't, and revise what needs to happen if another disaster occurs. We only need to look at recent examples to underscore the importance of planning and prevention. Hurricane Harvey in 2017 delivered the highest total rainfall in U.S. history, when 19 trillion tons of water, equivalent to 1 year of rainfall, fell in just a few days in the Houston area. This overwhelmed wastewater facilities for an extended period, leading to unprecedented sewer overflows. 61 public water systems and 40 wastewater treatment facilities were destroyed or became inoperable, requiring boil water notices in more than 200 public water systems. A total of 266 hazardous material spills or discharges were reported or observed, and 8 million cubic yards of trash, as well as a toxic mix of chemicals, sewage, and biohazards contaminated floodwaters. So this recent example really highlights the potential health hazards of floodwater and in floodwater, and the importance of planning and remaining vigilant to protect yourself. Thank you very much, and please contact me if you're interested in learning more.
Hi everyone, my name is Joseph Sullivan and I'm the Flood Resilience and Compliance Strategy Program Manager in the City of Philadelphia's Office of Sustainability. In my role, I manage the city's Flood Resilience Program, which is the city's coordinated efforts at flood risk management and focuses on tackling flood resilience from multiple angles, including mapping and risk assessments, regulations and code, outreach, engagement, and advocacy, as well as leading the city's interagency flood risk management task force. In addition, I'm a certified floodplain manager and split regulatory floodplain management responsibilities with our city's Department of Licenses and Inspections. Today in this webinar, I'll be covering the following 4 topics: why Philadelphia floods, climate change and vulnerability in Philadelphia, flooding impacts, and then lastly, Philadelphia's approach to floodplain management. So we'll start with why Philadelphia floods. To understand why Philadelphia floods, first we'll need to understand what flooding is and some definitions around flooding. Put simply, flooding is an inundation of normally dry land by water from any source. In Philadelphia, we experience flooding in several ways, including riverine, or when a river or creek overflows its banks, coastal, which can include sea level rise, flooding from high tides, as well as storm surge, and then inland flooding, which is also known as rainfall-driven, urban, or infrastructure flooding. This is flooding that happens away from a body of water and as a result of drainage issues and stormwater runoff from heavy precipitation. So as mentioned earlier, Philadelphia is vulnerable to multiple kinds of flooding, such as riverine, which is also known as fluvial, inland, which is also known as pluvial, coastal, and then also compound flooding, which is when multiple different kinds of flooding interact with each other and can have compounding effects. This graphic up here on the left on the screen visualizes some of the primary drivers of flooding in Philadelphia. And it's important to note that all sources of flooding will be exacerbated by climate change, which we'll get into more detail later on in the presentation. So we know that we're vulnerable to flooding, but why is that? Some of the reasons are due to physical factors related to geography and climate zone, including Philadelphia sits at the bottom of 2 large watersheds, the Schuylkill River watershed and the Delaware River watershed. So everything that happens upstream in the watershed can affect us downstream. Land is sinking due to land subsidence, while sea level is rising due to climate change and the melting of the ice sheets. We're in a region that experiences multiple different kinds of severe storms, including thunderstorms, hurricanes, and nor'easters. Our region is located in a coastal plain with many historic wetlands and has many naturally low-lying areas. And lastly, we have tidal rivers due to our proximity to the coast, which makes us vulnerable to coastal flooding such as high tides, sea level rise, and storm surge. Well, some of the reasons that Philadelphia is vulnerable to flooding has to do with our geography and climate. Other reasons have to do with our history and development practices, including the following. We have a dense built urban environment with a low tree canopy cover and high amounts of impervious surfaces, which can cause stormwater runoff challenges and that inland flooding that was mentioned earlier. Philadelphia also used to naturally have many rivers and creeks that have since been capped over into our stormwater infrastructure system. And that stormwater infrastructure system, more than half of it is a combined sewer system where stormwater and wastewater both go into the same pipe. And during periods of heavy precipitation, the system can get overwhelmed and lead to combined sewer overflows, which results in stormwater and raw sewage getting mixed and discharged into local water bodies and floodwaters. Lastly, we're one of the oldest cities in the country, and so we have very old infrastructure and housing, many of which was built before we had any regulations to guide safe development in flood-prone areas. So I mentioned earlier that we're built on top of many historic creeks and wetlands, and up here on the slide is a map of what Philadelphia's streams and creeks looked like before European colonization and then after. So as you can see, many of our historic creeks and streams are no longer present in the city. This is because during Philadelphia's early development, many of the city's natural creeks and streams were buried and rerouted into the storm sewer system. This made sense at the time because these waterways were heavily polluted and were causing public health issues. It also cleared space for rapid growth and urban expansion. But those buried waterways didn't just disappear. Today, many parts of our storm sewer system still carry water from these historic streams, so when it rains, especially with some of the more intense storms that we see, the system often can't drain fast enough, and this leads to flooding in areas that are not near the Schuylkill or Delaware or any of the other rivers, creeks, or streams in the city, but they're still vulnerable to flooding because of what's happening underground. So I want to cover a little bit more on fluvial flooding first. This is riverine flooding. When many people think about flooding, we often think about the two most common flood zones, the 100-year and the 500-year floodplains shown up here on the map. The light orange is the 100-year and the darker orange is the 500-year. These areas are mapped by FEMA, or the Federal Emergency Management Agency, using past data. They do not consider future conditions due to climate change. They also do not consider inland rainfall-driven flooding, so they solely focus on riverine and coastal. So our regulations currently only apply to the 100-year floodplain, which is the area in light orange on this map, which leaves much of the rest of our flood vulnerable areas without regulations to restrict development practices. And so floodplain regulations exist to protect property and life while building in these high-risk areas. And they're set by the federal level, by FEMA, but states and local governments can have more strict regulations. And we focus so much on the 100-year flood, but the name's a little misleading. So I wanted to take a moment to explain the concept of the 100-year flood event. A 100-year flood is the term that is used to describe a flood event that has a 1 in 100 or 1% chance of occurring in any given year. It doesn't mean that such a flood only happens once every 100 years. Rather, it's a statistical way of expressing the likelihood of a flood of that size in any given year. The name 100-year flood can sometimes give people a false sense of security. Many assume it means they're safe for the next 99 years after one happens, but that's not exactly how the probability works out. For example, if you have a home in the 100-year floodplain, you have a 26% chance of flooding at least once over the life of a mortgage. It's entirely possible for two 100-year floods to occur just a few years or even months apart. So a good way to think about this is about rolling a die. But imagine a die that has 100 sides. So every time you roll it, you have a 1 in 100 chance of landing on the 1. Every year you roll that die again, and the chance of rolling the 1 stays that same, 1%. Because of this misleading name, it's also commonly referred to as the 1% annual chance flood. Up here are some images of the different kinds of flooding we have seen over the years in Philadelphia, with coastal flooding from the Delaware River on the left, inland flooding from overloaded storm sewers in the top right, and riverine flooding from the Schuylkill River in the bottom right in our Manayunk neighborhood. So next we're going to discuss climate change and vulnerability in Philadelphia. So climate change is expected to increase the frequency and intensity of extreme events, which we commonly hear summarized as a hotter and wetter future. Right now, we get on average about 47 inches of rain each year. By 2050, that could increase to 49 to 50 inches, and by 2080 to 50 to 51 inches. Temperature-wise, we currently see about 5 days per year with temperatures over 95 degrees Fahrenheit. That number is expected to rise to 16 to 20 days by 2050 and 23 to 37 days by 2080. These projections we're talking about are based on global climate models, or GCMs. These are large-scale computer simulations that use physics, chemistry, and historical climate data to predict future weather patterns under different greenhouse gas scenarios. The models shown here use two different scenarios, SSP 2-4.5, which assumes moderate global action to reduce emissions, and SSP-7.0, which assumes higher emissions due to less international cooperation and more fossil fuel use. According to these models, total annual precipitation could increase by 5 to 12% by the 2050s and 8 to 16% by 2100. However, global climate models tend to underestimate how severe extreme weather events will be, especially short, intense storms that cause flooding. So that's why the Philadelphia Water Department worked with consultants to apply a more detailed peer-reviewed method. Their results show that the most extreme precipitation events, so a 1 to a 100-year storm event, could become 30 to 40% more intense under a moderate emissions scenario, or 40 to 59% more intense under a high emissions scenario by 2100. The key takeaway here is that while the increase in precipitation overall may only seem like a few more inches per year, this rain will be falling with much more intensity in short periods of time, which stresses infrastructure more and results in more catastrophic flash floods. It won't be uncommon to see a drought, then extreme rain, and then a drought cycle, which is more concerning from a flood resilience perspective. So you might be wondering why climate change amplifies existing vulnerabilities. A lot of this is tied to the water cycle, which impacts the weather. There are three principles that govern the water cycle that are affected by climate change. First, the atmosphere can hold more moisture when it's warmer. This is a principle known as atmospheric holding capacity. You can think of it like a sponge. The warmer that the temperature is, the bigger that the sponge that the atmosphere can be. So it holds more moisture before releasing it. This means that we'll see more intense rainfall events and potentially longer dry spells in between rain events. Secondly, warmer air increases evaporation and transpiration rates. This can be especially problematic during drought conditions when plants need water more than ever. And lastly, temperature changes can influence global circulation patterns, both in the atmosphere and the ocean. These changes impact weather patterns like El Niño and La Niña, which have been used in the past to make water resource planning decisions. To show what these changing frequencies and intensity mean in practice, I'll use Hurricane Ida as an example because of the devastating impact it had on Philadelphia. So using outdated flow data from 1964 to 2002, Hurricane Ida wasn't even a 100-year event, which is the flood event that we base our regulations off of. It was approximately a 65-year event, which has a 1.5% chance of occurring in any given year, and a 32% chance of occurring over a 25-year period. So using current flow data, which is from the last 20 years, 2001 to 2021, it was actually approximately a 30-year event. So that has a 3.3% chance of occurring in any given year, or a 57% chance over a 25-year period. Now, if we look at the end of the century using a high emission scenario, the flows from Hurricane Ida on the Schuylkill River could be expected to be a 6-year event, which has a 16.7% chance of occurring in any year and a 99% chance over a 25-year period. So if we think about the scale and impact that Ida had on Philadelphia, it's very concerning to realize that the probability of an event like that happening again is much higher and not even the 1% annual chance risk that we take where we base our regulations off of. So we've discussed how sources of flooding such as riverine and inland rainfall-driven flooding may increase with climate change, but as I mentioned earlier, we're vulnerable to many other kinds of flooding as well, including sea level rise. So sea level rise is what's known as sunny day flooding, so it's the permanent inundation of land by water. You may wonder why Philadelphia is vulnerable to sea level rise when we're about 90 miles from the ocean, and it's because the lower section of the Schuylkill River and the entire length of the Delaware in Philadelphia are tidal rivers. So as sea level rises in the ocean, it pushes water up into the tidal sections of our rivers that flow into the ocean, which results in sea level rise. And based on current projections, it's likely that we will see 1.25 feet of sea level rise by 2050 and 3 feet by 2100. However, the magnitude and timing of sea level rise in the coming century hinges on the rate of ice loss from the Greenland ice sheet and the Antarctic ice sheet. So because of this uncertainty, we could see 5 to 6 feet of sea level rise by 2100. And it's also important to note that sea level rise will continue to rise for hundreds of years, even if emissions are stopped completely today. So as mentioned earlier, the lower portion of the Schuylkill and all of the Delaware in Philadelphia are tidal, so they're susceptible to sea level rise. Up here on this slide visualizes what that sea level rise could look like under these 3 different scenarios on the Schuylkill and Delaware. So on the left, 1.5 feet by 2050, in the middle, 3 feet by 2100, and on the right, 5 feet by 2100, because there's some uncertainty between 3 feet and 5 feet by the end of century. As you can see here, under a 5-foot sea level rise scenario, that would be absolutely devastating for certain communities in Philadelphia, particularly in Southwest Philly, which you can see on the map there. So in addition to sea level rise, extreme storms like hurricanes are also expected to become more prevalent over the next century due to climate change. Experts at NOAA's National Hurricane Center have shared that Philadelphia could see a Category 2 hurricane under our current risk, and by mid-century, or 2050, this could increase to a Category 3. And by end of century, due to some uncertainty, we could see anywhere between a Category 3 or a Category 4. With that said, there's much uncertainty around how climate change may impact the frequency, size, speed, and intensity of hurricanes, which makes planning for them much more difficult. The next few slides will show a few maps that will visualize what that impact could look like depending on a Category 2, 3, or 4 hurricane. So first is a Category 2, which is what our current risk level could be. The blue is less than 3 feet of water above ground, the yellow is greater than 3 feet, orange 6 feet, and red 9 feet. And then up here is a Category 3. And then lastly, a Category 4 hurricane. So now that we know more about our vulnerability to flooding from an infrastructure and exposure standpoint, I also want to talk about resilience. And so when we're talking about resilience, we're talking about a community's ability to recover from disasters like flooding. But resilience isn't just about physical infrastructure, it's also shaped by social conditions. We know Philadelphia is highly exposed to flooding hazards, but what makes recovery even harder for many communities here is what's known as social vulnerability. Social vulnerability refers to factors like poverty, racist housing policies, urban renewal, and systemic inequality, all of which have concentrated risk to certain neighborhoods. In Philadelphia, frontline communities, which include communities of color, low-income households, indigenous populations, and both the young and elderly are often the first and worst hit. These communities tend to face greater exposure to hazards, have fewer resources to recover, and are more susceptible to long-term damage. That combination leads to a disproportionate loss of income and assets, which makes it even harder to bounce back the next time disaster like a flood strikes. The next few slides are going to highlight some vulnerable infrastructure in the city. So up here highlights just how much of Philadelphia's critical infrastructure is exposed to a 100-year flood. That's the 1% annual chance event, and this includes both riverine and inland flooding data. So current estimates show that about 20% of medical facilities, these include hospitals and patient clinics, could be exposed to a 100-year flood event. 14% of critical services, these things include fire, police stations, and other services that serve, or other facilities that serve vulnerable populations, could be exposed to a flood under this scenario. And then lastly, 65% of transportation assets, this includes roads and also public transit infrastructure, could be exposed. When these kinds of infrastructure experience flooding, it disrupts essential services to the residents of Philadelphia and makes recovery much harder. So next we'll cover some impacts due to flooding. So flood modeling and maps are what we've looked at so far, but these are theoretical tools, so they use simulation and probabilities to estimate where flooding might occur. It's helpful for planning, risk awareness, and future preparedness, but while models provide information on where flooding might occur, we're now going to look at real examples of where flooding has happened in Philadelphia to turn some theory into lived experience. On the left here is a new map created by the Flood Risk Management Task Force that shows where we have reported damages from flooding in Philadelphia. This is based on past insurance claims, citywide surveys, and reported damages. As you can see, there have been many reports of flood damage outside the FEMA flood zones, showing that flooding does not only occur next to rivers. In fact, on average across the country, approximately 20% of all flood insurance claims are outside of the regulatory floodplain. And on the map on the right here is an aggregated map of repetitive losses, which include 2 or more flood insurance claims of $1,000 or more in any given 10-year period. As you can see, many of our repetitive losses are concentrated in Manayunk and Eastwick, as well as the Northeast, but they're also scattered throughout Greater Center City, North and South Philly. At the property level, we can see costly structural damage, power outages, and displacement of residents due to damaged structures that are deemed unsafe for living. Economically, flooding can shut down roads and transit infrastructure, disrupt supply chains, and lead to business closures and income loss. Particularly for small businesses, the loss of income and operations due to a flood could threaten the business owner's livelihood and those that rely on those goods and services. Environmentally, floods can create compounding events, like a heat wave following a power outage due to a flood, or worsened water quality due to combined sewer overflows, where raw sewage can be discharged into the floodwaters and local water bodies, and potentially trigger public health risks like exposure to sewage or mold post-flood. Up here is an example of the impact we saw from flooding due to the remnants of Hurricane Ida in 2021. As you can see from some of these statistics pulled out, this was one of the most costly and damaging events that Philadelphia has experienced. And to this day, the city is still recovering from the impacts from this flood. So lastly, we'll cover Philadelphia's approach to floodplain management. The Office of Sustainability has a flood resilience program, which is managed by myself. The program focuses on 3 main areas currently, those being floodplain manager responsibilities, leading the city's flood risk management task force, and managing the city's participation in the community rating system, which is a program through FEMA which provides flood insurance discounts for implementing activities that improve a community's floodplain management. Floodplain management in the city of Philadelphia is operated by 2 different city agencies, those being the Office of Sustainability and the Department of Licenses and Inspections. The reason these responsibilities are split is because it allows us to focus on 2 different aspects of floodplain management. L&I, or Licenses and Inspections, is an operating department that's primarily focused on permitting and code enforcement. It doesn't have the capacity to be advocating for higher design standards or including and incorporating climate change and flood resilience considerations into development. So that's where Office of Sustainability comes in. My role is to provide additional flood risk information beyond the mapped floodplain, include those climate change considerations, and advocate for above code design in development in the floodplain. When talking about floodplain management regulations, it's important to understand that there are many different regulations applying at different scales. Philadelphia participates in the National Flood Insurance Program, or the NFIP, which provides federally backed flood insurance to communities who adopt and regulate to federal floodplain management standards. In addition, locally, we have our own floodplain management regulations, some of which exceed the minimum standards that are set by the NFIP, and our zoning code, which governs land use in the floodplain and other areas of the city. We have also adopted international codes, which govern things like building codes, as well as adopted flood-resistant design and control standards set by the American Society of Civil Engineers. Lastly, we also have a nationally recognized stormwater management program with regulations that govern stormwater management controls and infrastructure post-development to ensure that we are not contributing to increased stormwater runoff due to impervious surfaces. So the city's Flood Risk Management Task Force is the coordinated approach to flood risk management across local government, The formation of the Flood Risk Management Task Force followed the American Society of Civil Engineers' call for a national flood risk management strategy in 2004, which in the wake of Hurricane Katrina and other catastrophic storms urged all levels of government in the United States to develop and align sustainable flood risk management strategies. Today, the Flood Risk Management Task Force is comprised of 15 city departments and agencies with the following goals: protect communities from flood risk, advance climate adaptation, ensure smart infrastructure and land use decisions, and build collaboration among city agencies on flood risk management. As I mentioned, there's about 15 different departments who play a role in flood risk management for the city, and you can see them up here. So because no one department owns riverine flooding as a responsibility, it's the responsibility of the task force and the coordinated efforts of all departments to advance flood risk management in the city. We're guided by the following 5 work streams up here that were determined by our strategic plan, including mapping risk assessments, regulations and code, mitigation, outreach, engagement, and advocacy, and partnerships and interagency coordination. So beyond the Flood Risk Management Task Force, the Place-Based Initiatives team through the Office of Sustainability has been leading the Eastwick From Recovery to Resilience initiative since 2021. Eastwick is an environmental justice community in Southwest Philadelphia that is one of our most flood-prone neighborhoods and has historically faced many environmental injustices and failed urban renewal projects. As part of this initiative, the Place-Based team is working with Eastwick residents and many other stakeholders that are seen on this graphic to co-develop a flood resilience strategy. The strategy will outline many options for resilience strategies to pursue, and centered among the strategy is community feedback and input. So the Eastwick residents play a large leadership role in determining the course of action for their own community. Outside of Office of Sustainability, the Philadelphia Water Department has 2 initiatives geared towards protecting water quality and flooding. First is the Green City Clean Waters Program, which is a nationally recognized initiative aimed at reducing combined sewer overflows, or CSOs. As mentioned, in older cities like Philadelphia, stormwater and wastewater often share the same pipe system, which can get overwhelmed during heavy precipitation events. So it's not only just a pollution issue, it's also a public health challenge because of the potential exposure to raw sewage. So Green City Clean Waters is a 25-year plan to tackle this by combining traditional infrastructure upgrades like expanded sewer systems with green infrastructure, which is things like rain gardens, tree trenches, and permeable pavement. These things capture stormwater before it can enter the storm sewer system, which reduces the volume of stormwater flowing into our combined sewer system. So this plan helps to limit and reduce combined sewer overflows, which can protect water quality and also improves neighborhood livability through incorporating more green space. The Water Department also has a climate change and adaptation program, which is focused on preparing water infrastructure for future climate conditions by integrating heat, precipitation, and sea level rise projections into planning, design, and operations. Another partner we work with for flood resilience in the city is the Office of Emergency Management, or OEM, which plays a central role in how Philadelphia prepares for and responds to flood events. They lead the development of the city's FEMA-approved hazard mitigation plan, which identifies flooding as a top hazard and outlines strategies to reduce long-term risks. OEM also manages public communication before and during emergencies through tools like Ready Philadelphia, which is the city's emergency alert system. In flood-prone neighborhoods like Eastwick, they've piloted more targeted alerts to better serve residents who are at the highest risk in the city. And during a flood, OEM coordinates the citywide emergency response, which brings together agencies across local government to manage operations, support residents, and help to guide recovery efforts. They also work closely with state and federal partners like FEMA and PEMA, which is the Pennsylvania Emergency Management Agency, to secure resources and assistance after major events. Their work ensures that Philadelphia is better prepared, more connected, and able to recover faster from flooding. So this concludes this section of the webinar. I put up some contact information, including the website to Philadelphia's flood management program and my email there. So if you're interested in learning more, feel free to check out that website or get in touch with me, and I'm happy to talk more about these topics. Thank you.
Thank you so much to all of our speakers. I'd like to review some of the key takeaways that our speakers raised and urge you to look at the documents that accompany this webinar, where you'll find some activities and references, as well as other resources that you may find helpful in fulfilling the competencies of this webinar. But first, I would like to talk about the key takeaways. As you heard, community members sometimes feel unheard by their government officials. Repeated flooding poses financial, physical, and mental health challenges for residents, and all of these combine together to really cause the tremendous impact that flooding has on people. Different types of flooding, fluvial versus urban, require different strategies to prevent and also to address once they're occurring. Flooding mitigation and preparation efforts are currently hampered by limitations on flooding data collection. Who's responsible for this data collection, and how should we fix that? These are key public health questions. Effective municipal floodplain management is key to flood mitigation. All of those upstream kinds of policy and other impacts are really important in order to reduce flooding for some neighborhoods. Collaboration among municipal departments is essential to manage the multidimensional nature of flooding preparedness, mitigation, and recovery. No single department manages this alone. There needs to be a very coordinated effort in order to be successful, truly successful, and see real change. Public health professionals should engage the public with empathy and clear communication, in addition to engaging their counterparts in other departments on all of the mitigation, preparedness, and recovery efforts. I would like to acknowledge Adrian Wood, who edited and produced the webinars, and all of the webinar organizers shown on this slide, who curated webinars on a variety of climate change and health topics. We invite you to follow this QR code to the College of Physicians YouTube page, where you can access the webinar series. The QR code on the bottom right will take you to the section on public health and preventive medicine. We hope you will consider joining this section to learn more about public health and activities to improve it in the Philadelphia region. Thank you for your interest in our webinar series on climate change and health in Philadelphia.